Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for this webinar, which helps your hospice grow through your care at home partnerships. My name is Laura Barnett, and I'm on the marketing team at Axxess. Before we get started, I'd like to tell you a little bit about Axxess. We're a leading technology company serving organizations that provide healthcare in the home. We offer a complete suite of easy-to-use, innovative software solutions, empowering hospice, home health, and home care providers to grow your business while making lives better. If you have a question for our presenters during today's webinar, please submit that through the chat box, and we will follow up with you after the webinar to ensure that it gets answered. Today, you'll hear from my colleagues and friends, Zondra Ellis and Marilee Orsini. Zondra serves as our Director of Hospice Solutions for Axxess. She has 2 decades of experience helping hospices excel operationally. Zondra previously served as the Executive Director for Kindred Hospice and Heart to Heart Hospice across Texas. There, she oversaw a hospice house, created and implemented a company-wide QAPI program for an organization that served more than 2,500 patients, and created operations that improved compliance and maximized reimbursements. Marilee Orsini serves as an Executive Vice President for Axxess and is also the founder and board chair of CoreCubed, an aging care marketing agency. She has been in the care at home industry for the past 40 years and is active in national organizations that support the industry. Her podcast, Help Choose Home, is starting its 4th season and oftentimes covers issues related to the end of life. Marilee and Zondra, I know you guys have a lot to cover today, so take it away.
Thank you so much, Laura, for that kind introduction. Thank you, everyone, for attending. We think today will be an exciting day for you, and we're going to cover peer-to-peer marketing. And what we mean by peer-to-peer marketing, we'll explain in more detail later, but it's basically one of the components of outreach that a community liaison or a marketing person would be responsible for. But we're going to go in depth as to why it might be a good idea to focus some of your energy there. Then we'll look at marketing strategy and how that relates back to peer-to-peer marketing. And finally, we'll end up with some action items that will make your marketing to the agencies in your area a little easier.
Marilee, I'm so excited to be presenting with you today. And I know a lot of my hospice colleagues on this webinar in attendance, kind of the lines get blurred for them between marketing and sales, right? So hospice sales is not as widely accepted as hospice marketing. There is a subtle difference, however. Many times our salespeople are called marketers. When you think about it, sales is the action of selling something, and marketing does include sales, but there is a focus on promoting a product through research and advertising, and what we'll be talking about today, peer-to-peer relationships that result in the exchange of information so that you can grow your business. So what you see here is the spark, which is marketing, and the fire, which is sales. It's important to remember that difference as we go through this today. We're going to help you strategize to support a better marketing effort for your organizations.
When we talk about peer-to-peer marketing, it really is the other agencies who provide care at home that are in your area. So really, when the target is peer-to-peer, how is it that you prioritize your efforts, your marketing efforts? And by marketing, what I mean by this is a pretty broad stroke effort. So targeting the audience is probably the first place to start. And so how do you prioritize those efforts when you're trying to reach your peers? And like with building relationships anywhere, it is best to start with who and what you know. So if you have contacts that are also in the home health or the home care space, and you're working for a hospice, then start there. Make those the first people that you reach out to, because you're going to have a much better chance getting them to talk to you or getting in front of them if you already know them, or if you already know someone who has referred you to them. So we're talking about leveraging your personal and professional relationships. So that would include any type of industry organizations that you belong to, any organizations or groups outside of your actual industry that might have people who are also involved in home health or home care. Excuse me. Zandra has a favorite saying that is, don't try to drink the ocean. And I'm pretty certain what she means by that is that if you've got lots of opportunities, and the key to successful marketing is actually targeting. So if you target who it is that has the best likelihood of being responsive to you, then you're not drinking the ocean. You are simply taking a nice, long, cool sip of water instead of going for bigger things. There's also publicly reported data that is available on most home health and hospice agencies. Not so much home care, but definitely for those. So you can look at publicly reported data, and that might help you know who it is in this peer-to-peer marketing that might be a better target for you. Now, you're selling hospice services and providing hospice services. So what you're trying to do is find agencies who would be, and people within those agencies, who would be receptive to learning more about hospice, to learning more about end-of-life care, to learning more about what are the benefits that actually making a referral to hospice when it's a patient's time that would benefit that patient the most. What are also the benefits to the home health agency or the home care agency? And so what you are really trying to do is hone in on your basic target that is also within the industry. Zandra, do you have anything you'd like to add to that?
I think you framed that very well, Marilee. It's very easy to become overwhelmed and kind of have that shotgun approach to your marketing efforts in hospice. This, by focusing in, like really understanding who your target is and what resources you have to leverage to develop that relationship where you get those referrals and maybe share patients over a span of time, is important for organizations to realize and implement in order to be effective to grow their business, but also to be mindful of the resources that they're using when they're out marketing, right? So labor costs, whatever cost you have for your collaterals, mileage, all of those things can add up very quickly. And we want to make sure that you get a nice return on your investment from your marketing activities. Okay, we're going to talk about marketing strategy and the basics. And I'm going to turn this to Marilee because she is the absolute expert. So let's go talk about marketing strategy.
Marketing strategy is something that, and you mentioned it earlier, the difference between sales and marketing is sometimes confusing. How does marketing fit in? What is marketing? And I like to say marketing is an art and a science. And there's a lot of complicated issues in marketing that start from creating an agency brand, which we are not going to talk about today. But some of these other basics in marketing strategy we will cover because they also are very helpful in peer-to-peer marketing. So this finding a way to stand out. Well, number one, you're a hospice agency, so you're already standing out a little bit. But within that hospice agency, do you have something special that you offer? Is there some region of the county or city or area that you actually service better? Is there some specialty that you have? Finding a way to stand out can include your messages and visuals, but it really is something that you want to make yourself memorable. And a real good way for hospices to find a way to stand out is in storytelling. Zandra has lots and lots of really nice stories about successes with hospice. And I think the biggest impediment or the biggest objection to selling hospice services is the fact that people think about hospice in terms of end of life, and sometimes people are not ready to admit that they or their loved one is nearing end of life. So the storytelling becomes a way to get over those objections and finding a way to stand out. We talked a little bit about the target audience, and let's just delve in a little more. Zandra, if you had to figure out what your target audience is, and you are a hospice agency, what are the criteria that you would put into that?
So as you mentioned, Marilee, we talk about geographical coverage, right? So I always call it, who are the people in your neighborhood, is how I frame it when I'm developing my marketing strategy. And then within that, I personally look at connections that I have. So whether they're direct connections or indirect questions. For example, I had a clinical director once who had a employment relationship with a home health in town. She had worked for them in the past. And so I leveraged her relationship to get in front of the decision makers at that home health agency. So that's one way you can do it. Another thing that's important to remember is that the hospice medical director is connected to other entities in your community. So whether they are working for home health, maybe have patients that are being cared for by home health agencies, maybe they know physicians that regularly refer to home health, your hospice medical director or hospice physician can be a wealth of information in helping you develop your target audience. Who are those people? You also really want to look at the data, the publicly reported data, right? So Marilee talked about that a few minutes ago, but when I look at it, I separate it out. So we have the really high performing home health agencies, and then maybe we have, the 1 or 2 star performing agencies. So right there in that sweet spot of 3 and 4 stars, you're able to identify opportunities for you to market ways that you can help them improve their quality scores. So that is something that you always look at. And the other thing that you want to think about with your target audience, and we'll delve into this later, is your ability to effectively and continuously make those marketing contacts. You don't want to have a group that's so large that you are missing months, quarters without dropping by to see somebody or making that contact with them with an effective marketing message. That's how I start.
That was good. Thank you, Zandra. I'm going to simply mention what target preferred channels are, because what we mean by target preferred channels is if someone is on social media and they are getting information from social media, that would be a target preferred channel for that specific person. If someone really likes phone calls, that's a target preferred channel. If someone likes personal notes and is really appreciative of those, you can't use those too often, but that's a target preferred channel so that you're getting your message in front of the people. Now, understand, we've already identified a target audience. So in terms of building that relationship and getting them to pay attention to you, it's communicating in ways that they prefer to be communicated with. This is establishment and extending of the agency brand. That is a week-long workshop, I think, to talk about branding. But basically, it means staying true to your agency brand. So, when you're communicating, make certain you're doing it through the agency, not personally. So you're communicating, and you always have your agency brand visible. If you're in person, you obviously need to have something that identifies yourself with the agency. And if it's online or written communication, same thing. Make certain that you have something that the person continues to have that reinforcement of who you are with and make that connection. We're going to talk a lot about measurable results in just a minute, but one of the things that I have noticed in terms of my many years of consulting with people about how do you grow your business, that oftentimes a salesperson or a community liaison will naturally, because it's human nature, go to those places where they feel most comfortable. And that certainly makes sense because you're welcomed and it's a warm reception and you have a good time there and you feel like you're making progress. However, you should measure that progress in terms of some specific measurable results. And we'll go over those later. But basically, bottom line is, are they referring to you? Are they appropriate referrals? And is your agency capable of handling those referrals? And are there positive outcomes for those? So you're basically taking your efforts and refocusing those on areas where you're getting the best results. And if you always do things based on results, then you will continue to grow your successes.
I love the idea of measurable results. And like Marilee said, we will be going into that in further detail in a few moments. But I have to share a story, Marilee. I've been in hospice organizations where your salespeople or clinical liaisons or marketers have been required to make a certain number of calls a week. So they have to make a certain number of stops in person. And usually that number is, well, what I saw was 40 in a week. So that means that they had to make 8 contacts each day. So that is not something that you can really measure. I mean, you can, but there's not really a result to that, right? It's just, did you do it or not? So that could be a starting place, but if that is the measurable result that you're looking at today, the number of contacts is not nearly as important as the quality of those contacts. So just something to keep in mind when we talk about measurable results. We're talking about real numbers that influence your business in a positive way.
Yes, and I've oftentimes heard people say, don't mistake activity for results. And oftentimes what we are looking at is measuring activities, which is one thing to measure, obviously, but not as accurate for success as measuring results.
So it's important to find a way to stand out. And when we talk about standing out, we talked about I call having a presence, right? So I'm fortunate that my name is Zandra, and I'm kind of tall and kind of a big person with a big personality. So I generally don't have a problem standing out when it comes to making those relationships from a personal brand perspective, right? And I'm representing the hospice organization. So my personal brand is many times the first thing that a home health agency will see or know when we're developing that relationship. So outside of that, one way I want you guys to remember that you are the hospice experts and that the home health folks that you're calling on are your colleagues. So you work in the same industry, the home care industry or the care at home industry, but you may be on different teams. So you're in the same league, but you're on the same team. So remember that these folks are your equal and that you are bringing them something of value. So one thing that is simple to bring is quality scores, right? So you don't want to come to them and say, hey, I noticed on the CMS website that you're a 3-star agency, and I think if you partner with our hospice, you'll be a 5-star agency in no time. That's not what we're talking about here. What we're talking about is the quality scores of the hospice organization that you're representing. Currently, hospice does not have the star rating system that home health has. But there are ways that you can take the publicly reported information and even the internal information, data that you have on quality from within your organization, and share that with referral sources so that they understand that you are doing a good job of taking care of your patients, that you're compliant, and that you would be an exceptional partner for them to transition patients to when they're hospice appropriate, but not before, right? So also talk about support programs. Is your hospice organization offering palliative care? Do you have a pediatric program, or maybe you have a general inpatient unit that you can use to care for patients who need a higher level of care? So those are all things to think about when you are finding your way to stand out. And I'll go back to the inpatient unit. Some people don't realize that you can have patients that don't meet the general inpatient level of care requirements for an inpatient unit, but they need a place to stay for a couple of days because there's a family wedding out of town and everybody's going. So from the home health perspective, that can create a little bit of a dilemma. Who's going to stay with mom while everybody goes to the wedding? Well, you could offer to let the home health, talk to their patient and loved ones and maybe stay a couple of days in your inpatient unit. Now, that's not free. If it's free, that's an inducement and we cannot do that. But if you charge them the regular routine home care rate for each day that they're there, then they can stay there. So think about how to leverage what you have to offer support to the home health organization. So when we talk about support programs, don't forget bereavement. So our charge as hospice providers is to provide bereavement services to our patients, their loved ones, their friends and neighbors. Offer bereavement services to the home health organization. You don't get reimbursed for that bereavement. We're required to provide it at no cost. So if you offered bereavement services when the home health agency finds it necessary for a family whose loved one has died, then as part of the community, you can provide those bereavement services to a home health agency and their patients and loved ones.
And what you're really doing is you are leveraging your existing relationships to build on deeper relationships and expanding those relationships. So again, we are talking about a very small niche in terms of your capabilities and your outreach to grow your hospice referrals. And we're really talking about collaborating with the other peers in the industry. So you're educating them about what hospice is. You're collaborating with them, as Zandra just gave great example in terms of being helpful when they need help that's outside of their capacity. So it really is looking for ways you can collaborate with others in your industry, in your region, to grow those relationships into deeper relationships so that they understand when it's time to make a hospice referral and how it benefits them and their agency for them to make a hospice referral. The other thing when you're doing this, and this is probably true for when you're marketing to anyone or when you're building relationships with anyone, but authenticity and your personal capabilities, both of those things really have to be included. And what I mean by authenticity is just not trying to be someone who you aren't. If you are have a particular local accent or like particularly local things, and it's who you are, and say you love cowboy boots and barbecue, bring that authenticity with you in those relationships. Don't try to be someone you're not, or don't try to emulate someone that you think is doing the job better than you, because in the end, it's who you are and what you bring to the table that's actually going to be important. The other thing from an agency standpoint is your personnel capabilities. Are other people in your hospice also willing and able to offer any type of assistance or stories or help in terms of growing relationships? And I oftentimes am in situations where I am exploring an idea or exploring a relationship, and it really does start off with finding common interests. And then once you've got those common interests established, that's when you go back and find a way to stand out. And some of the way to stand out may simply be you and your ability to make those relationships and make those contacts, and to bring other people in the agency along so that they are also growing their contacts. So it really, the main idea is the more people who understand hospice and who understand how hospice can be beneficial to them and their patients or clients, the more capacity you're going to have to make people refer to you.
Marilee, I love what you said about authenticity, right? It's important to, whether you're a sales or marketing leader or you're a marketer, it's important to understand and identify when your authentic self is not the best fit for the home health organization that you're calling on. Maybe it's a little bit of a stretch. There's great potential for a lot of referrals. So sometimes folks are tempted to hang on to those accounts because of the potential referrals that can come. However, a barrier is created when that connection between the marketer and the home health team doesn't happen. So then no one ever gets those referrals, right? So it's important to be able to step back. It's important to be authentic, but it's also important to step back and understand that, hey, maybe this isn't a better fit, and work within your team to find someone who might be a better fit for that organization, and then work together to develop a relationship there.
We're going to dig a little deeper here into the target audience, because you have all kinds of options for the other home care agencies, the other home health agencies in your area. So understanding their business model is really pretty important. And some good examples from a home care standpoint, you have private pay home care agencies where most of their clients are paying privately. And in a lot of those scenarios, that home care agency is basically caring for the person from frailty to the grave. So they're there and they're providing sometimes 24/7 care. So understanding the business model of the agency is really important, because someone in a strictly private duty scenario where they're providing that frailty to the grave care will welcome hospice toward the end of life, because they can still provide their 24/7 care, but they can bring in hospice to make that transition to end of life such a much better experience for their clients. There's also lots of home care agencies who are in the Medicaid space, and the same can go for that Medicaid space, that they can understand how they can work in tandem with a hospice agency. So if you really understand the home care business and their revenue sources, you've also got regulatory requirements that might come in. You want to make certain that you are always adhering to any type of regulatory requirements, but you're looking for common ground, and that common ground is all of us are going to die. It is a given. And so when we die and how we die is where hospice comes in. So if you have a home care agency or a home health agency, having them understand the benefits to the patient to have a hospice referral toward the end of life, and the benefits to their agency. because they're going in a home health scenario, they are probably going to increase patient satisfaction because they're not going to be caring for patients at the end of life and not able to provide the services that they really need. In a home care agency, you don't actually have anyone that's measuring anything, but bringing hospice in will certainly help that home care agency with their family referrals and the family satisfactions, because it will make for a much more pleasant experience toward the end of life. So any data you can find on the agencies to see what types of patients are they caring for, and are they caring for really acutely ill patients? Are they, where are they in the whole spectrum of care? And then finding common ground. When you talk with someone, if there is any kind of commonality in what you like or what you do, or how you're feeling about things, your basic elements of relationships. So you're finding common ground, but it's easier to find that common ground if you go into that relationship understanding how hospice can help them specifically and how they can make the best referral to you. We're not going to go much into this resonating messages and visuals because, again, that is a whole deep subject. But the idea is when you are communicating, we're talking about communicating again in different channels. So this might be phone calls, it might be mailings, it might be personal notes, it might be social media postings, it could be webinars or speeches, or different types of activities that you're providing in addition to what your normal marketing is. But anytime you are using messages and visuals, this is sort of a list of the different ways that you could approach people. It takes at least 10 touches, and by touches I mean some way they've interfaced with you or your agency. It takes at least 10 touches for someone to recognize your face, recognize the agency, put it together that who you are and where you're coming from. So if you are always selling, if you're always simply giving them information about your agency and why they should refer to you, then that's going to be less impactful as using a lot of different types of communication. So informative, regulation changes or industry changes that they may or may not know about, memorable things. If you have, again, Zonder's got great stories. So all of these success stories about hospice are memorable things that you could share with people. Educational, oftentimes there are industry educational series or webinars or different things that you could share with people that they might not have been privy to and didn't attend. So, and entertaining is one of them that you have to be really careful with, but it's good as long as you make certain that you're not doing anything that is that would reflect badly on yourself or your agency. So entertaining, it can't be sexist, it can't be racist, it can't be have any religious overtones. It really, you have to be careful with that. But entertaining is also, if you throw that in ever so often, it will associate in the person's mind that you are actually making a relationship, creating a relationship, forming a relationship, solidifying that relationship, and not just selling.
I think the entertaining points that you made are vital, right? And I also think that it's important, entertaining is at the bottom of our list. And one of the reasons it fits well there is because you wouldn't want to lead with entertainment, right? You need to establish yourself as a professional. And, if your authentic self tends to be humorous, that's fine. But, the entertaining part, you can entertain lightly, but to entertain in a relaxed manner, I think you want to make sure that you have really engaged with that person, and that relationship is really starting to take form. Okay, so meaningful communication channels. We talked about the goal of being target specific. We've talked a little bit about email, phone calls, and personal notes and in-person visits, but I want to spend a minute on social media. So we, as healthcare providers, always have to be careful about what we put on social media, right? We can't be patient specific, and some home care organizations have policies about what employees can post and what they can't post. I worked for one that really had everything on lockdown and you couldn't post anything. So, and I've seen hospice organizations post wonderful things about their volunteer program and what a difference that they make. There's a regional hospice in the southeast that does a wonderful job on social media of pushing out the positive message of what's going on with their organization, how they celebrate their volunteers, you know, and different so they're entertaining posts, right? But there's lots of education in them as well. So that's a really nice way to get your message across. There are industry-specific Facebook groups. If you're on Facebook and if you're not a member of one of these groups, search home health, search hospice, search home care, and groups will come up that you can join, and it will help you be part of the home care industry community as a whole. And more specifically, it will help you develop those home health relationships, so you don't want to be the only hospice person crashing into the home health specific Facebook group, right? But you might want to have your own hospice specific Facebook page and invite the home health people to join so that you can start making those connections with each other. LinkedIn is a very powerful tool. We use it a lot at Axxess. And what is important to know about LinkedIn is that the more that you post, the more frequently people will see your posts. So there's an algorithm there, and depending on how much you post, it may be the first thing. I may see Marilee first, you know, on my feed if she's posting a lot, and then people who post less will be in order, right? So the person who posts the least that I'm linked to will be at the bottom of any posts that have come up. So you want to post frequently. I think it's important to remember when you're providing maybe industry content that's not that exciting, make sure that you include some kind of picture or infographic there just to draw people's attention to your post, because we know that having a graphic there, something to draw people's attention to it, that increases the likelihood that it's going to be read. Just be persistent, keep posting, post for your organization if that is something that you are allowed to do, post for yourself, make sure to tag your organization and maybe home health, hashtag hospice, and see, you know, about making those connections that way and really establish yourself as a thought leader in the hospice industry that brings value to other home care agencies. So email. If you were calling on me and I was busy and I said, hey, just shoot me an email, it's important that you follow up on that email. So whatever means of communication that you're using, make sure that you're consistent with it. I love a personal note. I think that gets a lot of attention these days. I had a fabulous marketer that worked for me many years ago, and she was absolutely divine when it came to communicating with home health organizations and other referral sources. And she knew what the best way to communicate was. If it was formal, it was email. She would call and check on them. She would send personal notes on their birthdays. You know, she would stop by in person and visit, especially if she knew that something was going on at the agency that day or the home care agency that day. She just knew how to use the right channels of communication at the right time. So Marilee, what are your thoughts about meaningful communication channels?
Well, you did a great job going over these, and all these are good. I have two things I'd love to say. You talked about LinkedIn. You're just spot on that. One of the things with Facebook is that if you comment in Facebook, that will do the same thing as with LinkedIn, because the more comments a post gets, the more it's going to show up on your feed. So just a relevant comment to whatever the Facebook post is will keep that Facebook post live and have it come back up. And the other thing I'd like to say about messaging, please do not use text messaging to someone unless it is in a specific response to something that they've asked you and you are sending them an answer or some reason to have a text message. I absolutely hate, and I think most people would agree with me, any type of texting that is a marketing message or something that's not important, because when I get a text, then I'm going to look at it, and I don't want to look at it if it's not something that's really relevant and important. And I would say in-person visits, we haven't done that for a long time, but we are hoping we can do those in the future. And go back to the other list where we talked about what type of communication you should have, that whole list of informative, engaging, memorable, educational, and entertaining. That fits perfectly in with social media. And I like nothing better than having something that is either a meaningful statement or a life statement that really resonates and has a lovely visual with it and is positive. And I love sharing those things because it not only helps the person that posted it and you're sharing it, but it really does bring a sense of community to the whole conversation.
Marilee, your comments make me think about using the right channels of communication and the right messaging in those channels of communication. So I have had the opportunity to call on an organization where I had back channel relationships. So, and those were pretty strong relationships, one of them being with the founder and CEO. So in my attempts to connect with him, I kept text personal, right? And then marketing efforts would be via email, so that we had a distinct channel of communication for personal and professional. And since the pandemic, I emailed and sent messages via email to him, and I would get a response, which was fine, but I was persistent and I sent an email with specific content, and he responded almost immediately and said, I want to know more. So while we're talking about communication channels, just a gentle nudge to remember, like Marilee said, it takes 10 contacts. Even if you have an existing relationship, don't take that for granted in your communications. Make sure that you have that same level of consistency with someone that you have an existing relationship with as you would someone that you're working to develop a relationship with. Okay, let's talk about measurement of results. So we think about referrals, right? So how many referrals do we need to get? So we generally have a goal as a hospice organization. We need to get 50 referrals this month, right? And then we break that down amongst the marketers and figure out who's going to be responsible for what number. So you want to keep very clear records on your referrals. One of the worst things, especially if you're a leader in a hospice organization, is to have marketing people fight over who gets credit for the referral. So it helps kind of curb that, but it also helps to keep detailed information so that you know when the referral came in, the patient, the diagnosis, if that's available. Also, you want to know if the referral came from a hospital, ABC Hospital down the street or ABC Home Health down the street. You want to know what person within that organization actually made that referral, right? So I know many times that I have gone to follow up on a referral and it was from ABC Home Health. However, I didn't know whom at ABC Home Health made that referral. So it makes it more complicated to go back and have that meaningful connection. If I call ABC Home Health and I have to say, hey, this is Zondra Ellis from ABC Hospice, and I'm hoping to speak to whomever made the referral for Miss Sally Jones. It's a lot easier to call and say, hey, this is Zondra Ellis from ABC Hospice. I'm calling about Miss Sally Jones, and I'd like to give an update to Susie, who gave us the referral. That is a better way to make that contact. So you also want to keep track of your referrals that turn into clients or patients. So hopefully you're tracking your conversion rate. So the total number of referrals that you have and the total number of admissions that you have. You want to make sure that you're consistently tracking that information so that if it looks like maybe your conversion rate is a little low, you can go back, circle back to your marketing efforts and make sure that your messaging is getting to the right people at the right time. So you want to, we talked about those referral sources, right? So, and we're really talking about the relationship with a home health and just with a home health provider. But if you think about your referral sources, you want to know who they are. We talked about that also. But more importantly, you want to know which one of your referral sources, or how many of them, which ones are also making referrals to home health. They can help make the connection between the home health agency and the hospice organization. So I've been successful with that many times. It works like magic. So we know a lot of home health agencies also provide hospice. That's one easy call for that referral source to make that call and go directly to kind of the one-stop shop. However, if you are working, if you have a good relationship with that referral source and they have a good relationship with the home health, you can make it as seamless as the one-stop shop when they make a referral. And the benefit of that is now you have a relationship with a mutually beneficial relationship with a home health organization. So referral sources that refer those who use hospice. So think about that. You also want to keep very detailed information about your admissions, your discharges. And so we're not talking about deaths, we're talking about live discharges, your length of stay, your average length of stay, your average daily census, and your growth. So what does the historical growth look like, and what is your trajectory looking like? So when Marilee and I were talking about this slide, when we were working on this little project together, I would said, you know, in hospice organizations, many times the temptation is to go from 0 patients to 50 patients in 6 months. That's great if you could do it. Healthy hospice organizations tend to have a growth that I call wavy gravy. And I call it wavy gravy because, you know, you'll creep up a little bit and then all of a sudden, you know, you'll have patients die and you start to go down, and then you get a bunch of admissions and it starts to go up and it may be stable for a while. But what you see is really those waves of growth, and that incremental growth over time will get you to a sustainable goal, and you will enjoy a good relationship in the community because you're bringing on patients who are hospice appropriate. So Marilee, what do you think about the measurements?
Well, I think you perfect, but the whole idea, you're looking for hospice appropriate referrals. So when you're targeting and tracking and measuring results, what you're really looking for is those hospice appropriate referrals. Are they referring early enough in time so that the patient and the patient's family actually benefits from hospice? That's going to be determined by your length of stay. So what you're really looking for is, do the referral sources understand hospice and understand an appropriate referral? And the ones that do are the ones you're going to put at the very top of your list, because that means that you're going to get better referrals from them because they understand it. Then the other ones you just go back to, give them a better and deeper understanding of hospice and how they could have made a better referral. And then you're measuring results, you're doing more of what works, and you're also communicating and extending that relationship with those referral sources.
Very good.
The meeting. Now, this meeting can be either in person or video. So I think a lot of them this year have been Zoom meetings. There are days when I feel like I'm on Zoom all day long, but we've talked about most of these things. But the one thing we really haven't talked about are these last 3 points. And I love Zondra's interpretation of what does it look like for hospice marketing when I say own it and have a win-win ready to go. Those 2 things I think you do very well.
So I think owning it, thank you, Mary Lee. I think that owning it really is about owning the fact that you're a hospice organization and your approach should be around partnerships, collaborations, and that regular communication, right? So we want to avoid the ask and really provide extra benefits to their home health organizations. So it's important to remember the owning it part of, as a country girl, I'd say it's like shooting fish in a barrel, or we're all fishing from the same barrel, because a lot of patients qualify for home health and hospice at the same time, right? And so it's important to remember that you're in direct competition with this person, and you have to find a way around that hurdle to really make that connection. So you want to have a win-win ready to go. And when we talk about win-win, we talked about quality scores earlier, specifically around CAP scores here. So when a patient requires a more integrated level of care, a home health patient really needs a more integrated level of care, they may be hospice appropriate, and the hospice interdisciplinary team may be the best fit for them. When the patient's needs are not as intensive, think about seriously and chronically ill patients, diabetics. That's a great example. The multidisciplinary home health team is likely to be a better fit for them. So ensuring that the patients are receiving the right type of home care at the right time will help the home health agency improve their CAP scores, because their patients are going to be happy. So we know that patients who come from home health to hospice, a lot of times they have had a lot of issues, and maybe there's lots of call going on, and maybe the family's a little unsettled. Not that the care is bad, but it's just a lot. So when they come to home health and they have that interdisciplinary plan of care, everything kind of settles down a little bit. So by having the right patient and the right type of care at the right time will help improve your CAP scores, because families and patients will be more satisfied. So let's talk about the reaction quickly. So sometimes you're going to get the like, oh, yay, I love hospice. You guys do great things. And sometimes you're going to get, well, hospice took care of my grandmama and it was terrible. That has happened to me before, you guys. It is not a good place to be. So as hospice professionals, we know the value of listening. So we want to listen and empathize, and then try to, if appropriate, help them understand how it could have been different. So that might be like, well, gosh, I wish that they would have had somebody come out on call. You know, hospice has 24-hour calls, so, you know, I wish they would have sent somebody out. Don't ever say that that hospice organization was bad. You don't ever want to do that. But what you can do is listen, let them tell their story, empathize with them, and then offer suggestions about maybe it would have been a little bit better at this or a little bit better at that. So, Marilee, what are your thoughts about the meeting?
I just think you've covered it wonderfully, and we have about 5 minutes, so I think we can move on.
So research, know your competition. So we talked about those quality scores, right? You also want to know who are the players on their team. So, and who are their contacts? And a lot of that just comes from asking, like, Marilee, do you know Marianne, the administrator over at ABC Home Health? You know, that's a good way just to know your competition, know yourself, know your patient demographics, where your referral source is coming from, and the unique cost savings and cost benefits that you can provide to the home health organization. And obviously know your local and regional demographics. You can find out how many Medicare beneficiaries are in your market. And it's important to know that, because I did a startup for an organization in a large metropolitan area and come to find out that they had a very small number of Medicare beneficiaries. So it makes it a little hard to grow your organization if you don't understand who is a potential patient.
When we're talking about planning, there is proven research that if your plan is written down, it is going to be more effective. So in here, we schedule something weekly. That's because what we're talking about is growing relationships for your peer-to-peers, not the regular target markets for hospice, but the other agencies providing service in your area. So if you make certain that you schedule something weekly for that specific task and vary those activities. So, you know, you may not do phone calls and visits or emails, but you can do media, you can meet them at events, you can use your personal contacts to grow that list. Those are the types of things we're talking about, but whatever type of planning tool you use, you need to implement it for this. It can be an Excel spreadsheet, but you really do need to, as we talked about earlier, track what you're doing and measure your results from that in order to be successful. If you have some type of goal for cost for the services you're doing, then you can base that on whatever percentage most agencies in the private pay space use a percentage of revenue, but for hospice, it might be hours or time that you're allowed to use. And then also look for ways you can use staff to stretch your efforts. So if you're doing something that is, say you're doing a fundraiser, or you're participating in some type of a walk, an industry revenue generating walk, then you try to use your staff to stretch your efforts and have them included as appropriate in the kinds of things that you would do that would be appropriate for them. Again, you're trying to build relationships. You're trying to hone in on those people who are going to be not only most receptive to you, but also going to provide a better referral for your hospice. And this implement is sort of goes back to what I said before. It really does. If you write it down, it's going to be more effective. And a lot of people have done planning, and then that plan goes on the shelf. But you have to, we revisit plans weekly sometimes and monthly. But this whole idea of targeting the market, researching who's the appropriate person to get in contact with is what we're talking about. And then revise that plan. So you are revising your plan, basing it on what works.
Yes, and I would add quickly here, as a leader, make sure that you're coming from a positive place and embracing the implementation of your plan. So that Monday morning meeting, you're not walking in to the sales meeting or marketing meeting, you know, tired and not excited about what's going on, and willing to help solve problems to make your marketing program better. So as leaders, you want to make sure that you are engaged in what is going on, and that plan doesn't end up on the shelf, like Marilee said.
And if you are interested in finding out more about Axxess Hospice, you may, I guess you get this presentation and there will be a link included here. And Zandra, you have done a fabulous job. Thank you so much for partnering with me on this. It's been fun and I hope informative to our audience. And Laura, do we have questions that we need to answer before we end?
We did not. I think you guys did such a wonderful job. You answered everything in advance. So thank you all so much for joining us today. And thank you, Zandra and Marilee, for sharing your insight and your wisdom and your time. And thank you all for joining us as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. If you would like to share this webinar with folks in your office or industry peers, everyone who registered will get a copy of the presentation. So feel free and share that with others. And stay tuned to Axxess.com. You can learn more about our solutions as well as other upcoming webinars that we are offering. So thank you all again and have a wonderful day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at Axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.